Hi, my name is Melanie and I am your IVF nurse. This week's episode is based on ZIKA and just some information for you for those that are thinking of traveling to the Caribbean, Mexico, or really anywhere in general. You want to make sure that your area of travel does not have an advisory warning for travel. So what you'd want to do is check with your Center for Disease Control in your country to see what is under the advisory for ZIKA. So this week I have been in the beautiful Riviera Maya in Mexico, and I just figured that many people are looking for a vacation and they just need to get away. However, when you're planning pregnancy, you need to be smart about it. Zika infection during pregnancy is a cause of microcephaly. Now, during pregnancy, a baby's head grows because the brain grows. Microcephaly can occur because a baby's brain has not developed properly in early stages of pregnancy or stops developing shortly after birth. Congenital Zika syndromes, a pattern of birth defects found among fetuses and babies infected with Zika. There are 5 specific features. So severe microcephaly, where the skull is partially collapsed, decreased brain tissue with a specific pattern of brain damage, damage to the back of the eye, joints with limited range of motion such as clubfoot, and too much muscle tone restricting movement soon after birth. Now, this doesn't say that every woman who travels is going to be affected with the Zika virus if, bitten by a mosquito. However, it will increase the chances of having a child with one of these birth defects. So what does this mean for future pregnancies? Based on the available evidence and information, it is thought that the Zika virus in a woman who is not pregnant would not pose a risk for future pregnancies after the virus has cleared from her blood. This is based on what we know about similar infections, is that once a person has been infected with Zika virus, he or she is likely protected from future Zika infections. Now, how do you prevent being infected by Zika? Well, one, you can avoid traveling to these beautiful Caribbean islands or anywhere affected by Zika. You do want to check with your CDC just to make sure that wherever you're planning your travel, that it is not one of the areas that is on the advisory list. The other thing as well is that if you are planning to travel and you're not pregnant as yet but planning pregnancy, you want to make sure that for women it's 8 weeks from the time that you return from your trip to make sure that the virus is clear from your system. For men, it can live in the body for up to 6 months in the sperm. So if you're traveling with your partner, what you want to do is use contraception, so that way in the 8 weeks when she's clear, if you're using condoms or any kind of barrier method, then you can plan for pregnancy through the clinic. However, you will not be able to try via timed intercourse. So this would be when you're planning for frozen embryo transfer and the woman is clear. If in any event that you're looking to create embryos or do an insemination, then unfortunately you will have to wait until the man is clear, so 6 months from the travel date of return. That is my topic for this week. Thank you for watching, and buenos dias from the beautiful Riviera Maya. I am your IVF nurse. Please feel free to check out my website, www.yourivfnurse.com, or please send me an email, yourivfnurse@gmail.com, if you've got any suggestions, recommendations of future topics you would like for me to speak of. Okay, thank you.